This is Lindsay, and I am Brittany. I hope you guys know who I am because, like, I always post all the time, and I post about my new baby, so. But I'm going to talk to you guys today about the difference and different kind of, like, belly binding things. So this is just like a regular abdominal binder. It's like a surgical binder that they would give you at the hospital. And a lot of you C-section moms probably have gotten one of these if you had your cesarean births. So you can just put these on like this, and they kind of stretch a little bit. So with these ones, you can either put them up on your hips, or you can put them up on your tummies like this. But they're not very long, and they don't cover everything. So with our Bengkung wraps, you're looking at, it's going to wrap you from here all the way down to your hips. So you're going to have a lot more support. The other thing with these regular abdominal binders is they're kind of stretchy. So they don't really give the same manner of support as the Bengkungs do, because when you put them on, they're not going anywhere. They're really, it's not a flexible material. It's a strong muslin cotton material. Also, because it's cotton, it's breathable. So you're not going to sweat it like you would with this. Yeah. Because this is, what you call synthetic material, you know, like polyester.
Yeah, so a little bit of fleece or something in there. It gets hot.
You know, like after you have a baby, you're on fire anyways because of like all the hormones. So we don't need to make you any hotter. So
maybe if you want to lose weight,
no,
with this.
We're not worried about that. No losing weight. We need like all the cookies and all the fat to nurse the babies.
And you will sweat it out.
Okay, and then we can talk about the other ones. I don't have any with me, but they have like the postpartum girdles, like maybe you've heard of like Belly Bandit, and they have different sizes. So they have like small, extra small, medium, large, extra large. So when you get these, they fit, right? But then a week or two later, you're going to lose all the water, your belly's going to start to shrink, your organs are going to start to go back into the places where they go. And what's going to happen is you're going to need a new binder, which you don't need that with this. With this, you're going to purchase it once. And then you can wrap it to whatever size you are. So you can lose weight or you can gain weight, and it's not going to be an issue. Okay.
Okay. I'm going to talk about some of the benefits of binding. When you first have a baby, you know, you have that little bit of mommy tummy. Your abdominal muscles are separated out a little bit. Wrapping is going to help kind of bring all that back together. It's going to help provide support for your lower back, especially if you're nursing. Yeah. You know, you kind of tend to slouch over. Maybe this will help kind of keep you, I know, I was like leaning over the baby, so it's going to help keep you a little bit more upright. It's going to provide a lot more support, so you're not going to have that back pain as bad.
Shoulder pain, too. Just if you're up in alignment, it's a lot better for you.
Yeah. I racked my mom with this last night. I told her to go lay down or just go sit down, and she's like, I can't, like, move it. And I'm like, see, and that's what you're supposed to be straight. But as normal day goes on, you just kind of don't stand up straight anymore. Right. So this is going to provide a lot of support for that lower back and start moving things all back together, and it's going to feel really good. Brittany said she really likes it.
Oh my gosh, so. Yeah. I mean, the problem with when you have a baby, all of your organs are kind of shifting around to make room for the uterus, which is like really, it's weird. Like I know they have some videos online, like time-lapse videos of pregnancy and what happens to your organs, but they all shift around. That's kind of like heartburn is common, especially like towards the end of pregnancy, because your stomach is like all squished up.
You can't breathe.
Yeah, your lungs. It's all a bad deal. So this is kind of going to help everything stabilize and go back together when your organs are going back into pre-pregnancy. And then also the other thing it's going to do is you have relaxin still in your body. Relaxin is a hormone that helps your pelvis separate and makes childbirth easier. So that is still circulating through your body even after you have a baby, which can make your hips and like your SI joints, lower back, a little bit mobile or hypermobile. So it can contribute to extra lower back pain. This is going to help stabilize all of those ligaments and all of those muscles just before you can start your exercise. And I want to also stress that this is awesome, especially for people who are immediately postpartum, because you can't exercise and you can't get that core stability back, but this is to be used in conjunction with exercise as soon as you can get back to exercising, which obviously you clear that with your health provider, whether it's your doctor or your midwife.
As far as like when you combine, C-section moms or with anybody who had a vaginal birth, as soon as you're not in the risk of hemorrhage anymore and you feel up to it, you can, but we want to make sure that you ask your healthcare provider or your midwife or somebody that you talk to that's in the medical field to clear you before you go and start binding, just in case.
Yeah, especially with the cesarean moms. Normally it is Pages has stopped working. I hope it's still recording. Goodness. Unfortunately, or with the C-section moms especially, it's usually okay to start binding as soon as your stitches come out or dissolve, but that's still something that you want to clear with your provider because we obviously don't want to cause any harm.
Okay. Should we bind you now?
Yes, bind me.
Okay.
Also with the binding, it's a good idea to put a shirt on. I like this type of shirt that I have on because it comes down lower, and like I said, when you bind, you're going to bind your hips as well as your abdomen. So, and you want the shirt on because you're going to sweat. And this is like 15 yards of fabric. So it's really long and it's annoying to wash. I mean, you can wash it, but it's going to be a pain in the butt. So you want to kind of protect it from sweat and anything gross. So you want to wear like a binder with a shirt with it. Okay.
Why do they keep doing that?
I don't know. I hope it's still working.
We'll have to record this over again. Okay. So
Okay.
you have to hold that part.
Yeah, I think that's good, right?
Yeah. And you're going to start really low. This is going to go all over your hips, all the way down. Trust me, you will be able to get your pants down to pee. Okay, now how tight do you want it to be? I don't want to.
Squish me.
Okay. I'm like, I don't want to hurt anybody.
No, you won't hurt me.
Okay.
This is like awesome because it just, I mean, you know, you guys, I just had a baby at Thanksgiving, and so it's been about a week now, but like it just feels so good to have everything held in place again. It's like after you have a baby, you feel really squishy everywhere.
Yeah. It's been a little while for me, but it hasn't been that long. I remember. Pull that one. This top one is the one like I was doing my mom.
Oh yeah.
That one nice and tight.
The lowest one is always the biggest pain.
Yeah. And it'll move around a little bit.
Yeah, that's normal. And maybe we could turn this way so people can see how we're knotting.
Yeah.
So I'm just holding this top rail up here, kind of like this, and we're going to, these are twist knots that we're doing.
Yes. Around and around and around.
So you like make a postpartum mummy.
Yeah. This one just is like, I want to ride up.
And this does take quite a while. We're going to bore you for a second.
It'll be cool when it's done, though.
So you see we're just twisting and putting the top rail under the rail that's going around my tummy. And this works like a lot better if you have somebody do it for you. So I'm so glad Lindsay's here today to wrap me.
And is this one's a 16? Is that the...
I think it's,
16,
I'm pretty sure it's
16
15 yards.
You can get them longer, so
Absolutely.
You know, for someone like me, it's a little bit bigger. When I wrapped myself, it felt a little short, but you can get them in different lengths, and then they will go all the way up.
There we go.
A little zigzaggy there.
That's cool. It's like an eye for design. So we can also talk about kind of like some of the emotional benefits for this. Obviously the physical benefits is going to provide you a lot of support, which is good after you have a baby. But kind of the emotional benefits, it's going to force you to take time out of your day to care for just yourself, which is really important if you're a mom, because especially like in the early baby days, you're just caring for the baby. You're worrying about waking up to feed the baby and trying to keep yourself awake and trying to eat and change the baby and make sure the baby's not crying. So you're worried a lot about baby during early postpartum, but you know, sometimes we forget to care for ourselves. And this, like I said, it takes a minute to do, but it encourages you to take time for yourself, which is also really super important.
Almost there.
Yay! And you can see, like, this is my hips down here, and up here it's almost up to my bust. So this is like super long.
we go.
So we come to the end, we're just going to tie it off like that. And then you can take these extra little tails and tuck them in. There we go. But now I'm all bound, and I'll show you guys what the back looks like. And the front. And then you can either wear it like this. It's kind of cool. It's got this little cool design going on. Or you can
Cover it up.
use it as like, undershirt. And then if you put your sweater on, then nobody knows you're wearing it. Okay. See, like that. But as far as your posture stuff goes, it's hard to bend like this. So it's going to encourage you to keep better posture. See, like, look at me do a squat, right? Yeah! Good posture. All right, thank you guys for watching again. Brittany Chavez, this is Lindsay Mathis, and we're glad that you guys joined us today.